Welcome back to Focus on Morris County. I'm Joe Garifo, and on this segment of the program, we are going to focus on Morris View Healthcare Center, and in particular, the volunteer opportunities that exist at Morris View. And here to tell us about those volunteer opportunities is my guest. She is Karen Hogan, and Karen is the Director of Recreation and Volunteers at Morris View Healthcare Center, the coordinator, I should say. Karen, welcome to the program.
Thank you, Joe.
Before we start to talk about those volunteer opportunities that exist, give us a little overview, if you will, of Morris View Healthcare Center.
Well, it's a 283-bed long-term care facility, and we have a 15-bed subacute unit that's going on its second year. And we're doing really well. It's a county facility, and it's wonderful.
By subacute, people come in to rehab?
Yes, it's a subacute is when people have maybe a general operation, a knee or shoulder, hip, and they come to have the rehab. We have a great rehab department, and go back out to the community. Yeah. That's the overall goal.
Now, what are some of your responsibilities as Recreation Volunteer Coordinator at Morris View?
To keep people happy. We provide the mental stimulation, the game, so to speak. We do everything that you can possibly imagine to keep people happy. We don't want to see people depressed. We want their life to continue, and it's a really important, big part of their health.
When it comes to volunteer opportunities, I was browsing through the Morris View Healthcare Center website, which, by the way, is morrishumanservices.org/MorrisView. And as I was browsing through the website, I found some interesting programs for people who may be interested in volunteering at the facility. And there's one program, there's a gardening program, I understand, at Morris View. What can you tell us about this program and what a volunteer might do?
Well, right now there is no gardening program in the winter, but in the summer, we actually have raised beds out on our back patio and our courtyards at the facility, and that is so that the residents can pull up with their wheelchairs and still have the gardening experience.
Okay.
But we always are looking for people that will help with the residents. We have several of them that are great gardeners. They just need that little extra assistance, somebody to pick up the watering can for them or help them with the planting and whatnot. And it's been really successful. And anybody who doesn't have any gardening experience is fine too. We just need that extra help.
So you don't have to have a green thumb, so to speak, to participate?
Nope, just have fun.
And what do they plant? Flowers,
all
vegetables?
Kinds of flowers. We have an herb garden, and I'm hoping next year to be able to get another raised bed so that they could have a vegetable garden. It's been really successful. They and they take care of it all summer long, watering and doing their own care, weeding and whatnot.
Yeah. So. Okay, so that's the garden program, and you might want to consider that, I guess, maybe for late winter, early spring. When does that usually kick in?
We kind of start looking around April, May, because we have to start doing the weeding and pulling soil out, and they start telling me what kind of flowers and things they want, and then I go make the shopping trip, and so that's around the time that we start.
Okay, and that's interesting. You say the residents kind of tell you what it is that they would be looking for.
Oh, yeah.
Are they actively involved in the activities that go on at Morris View?
Absolutely. One of our jobs in recreation is to look at each individual when they come in that door and what they've done in their past life and try to make it work for them, adapting it to continue.
Yeah.
Life should keep on going, doesn't stop. So if they were gardeners and they love gardening, that's why we have the raised beds with the wheelchairs they can pull up, and we give them different tools and things to use to keep on doing what they enjoy.
Okay. Now, another program at Morris View Healthcare Center, I understand there is a computer lab at the facility.
Yes.
If a person wanted to volunteer here, what would he or she be doing?
You really have to know the computer pretty well.
Really? Okay.
This program was started, I think it's about 17 years ago, before I came, and there's still 5 gentlemen who are very, very involved volunteers, very computer guys who set this up within the community, and they've got it going. And since then, we've just updated the equipment, so it's no longer the big boxes they used to have. But we have locked codes and things like that. So you do have to be willing to want to come into the computer environment and be able to sit down and have somebody train you on what the lock codes are and things, the different kinds of uses of equipment. Some of it's adaptive equipment for the residents. Some who have difficulty with speaking, they have to use different kinds of keyboards, different kinds of mouses, and more of adaptive equipment. And then with that, we're able to give the residents still, we have the Skype so that they can, if they have family members that are far away, they can talk to them and see them, and they email. Sometimes we do the emailing for them. They like to make cards to send to their families.
Oh,
so
the
we have programs.
The e-cards? Or the,
We have a really great Hallmark one. And they have fun doing that. So it's giving them some more of their independence back and still being able to keep in touch. And I was not there, but I understand there was actually one resident years ago who got his college degree through the computer program with the help of a volunteer.
Boy, that's great.
So, yeah.
And I would imagine, too, that for the residents who are agile enough that by using the keyboard, it helps them maintain their agility?
Yes,
Is that?
yeah, their dexterity.
Yeah.
Some of them love to play the games. I think the bowling game is their favorite, and sometimes we have 8 computers in there, and they'll line up and they all put on their headphones and do the bowling game and challenge each other, so it's fun too, good interaction.
But you would, to volunteer for this program, you think you would need need at least to be familiar with
the people, exactly, yeah.
Do they have laptops or iPads or the
No,
tablets?
it's just the regular computer so that they can wheel up to it. And then we have a chair next to each station for volunteers. And we have it, our goal is to have it open every day. We pretty much do accomplish that, but volunteers are always accepted and needed. So.
Okay. And by the way, at the end of this segment of the program, we will give you the contact information for Karen if you want to volunteer for any of these programs that we're talking about here today. There is a friendly visitors program at Morrisview Healthcare Center. What is that all about?
That's really one of my favorite, and I think it's one of the most important programs we have. We have residents that are not able to actively participate in some of the group programs, either for their because of their diagnosis or their condition. They may be in their room. And just imagine how depressing it can be to be in your room all day staring at the walls. The friendly visitors are people that when I start, I train them, and usually I introduce them to maybe 8 to 10 residents. We have quite a few that are in need. These are people that don't have family that live nearby, so they don't have a lot of visitors. And again, like I said, they're not able to independently move themselves around. When the friendly visitor comes in, I'll introduce them to the people, and usually after about a 2 or 3 week period, coming one day a week, they've narrowed down their friendships to maybe 2 people that they really connect with, and then they develop these personal relationships, and that's the friendly visitor, and it means all the world to some of these people. We've actually been able to get some to respond in talking, come out of their rooms now more. We've actually had a success with that where they will now go out to the day room and join others occasionally. Through that, though, I think the big thing is the volunteers themselves have come to me and told me how great it's been an experience for them. I'll just give you an example. I had one girl from high school who was doing it, and when she went off to college, they kept writing to each other. This particular woman, we had to take her to the computer lab to be able to help her write her letters, but so it really got her out, where before that she just was in her room and very depressed. And when the girl comes back from school, she visits and brings her things and pictures. So it's really a great developing of relationships. Now, very important.
Now, when you say the residents do get out of their rooms for the friendly visitor program, do the friendly visitors help them get out of the room? I mean, are they trained? If the resident needs a wheelchair, does the volunteer get training to?
What will happen is we don't put that kind of burden on somebody just for security risks. But if the resident is in bed, then they visit in the room. If the resident, because we try to get them in and out of bed, it depends on their condition. If they're already in a wheelchair, the friendly visitor just tells the nurse's station, we're going to go for a walk, and can take them throughout the facility or outside. And spend their time together.
What about meals? Are volunteers needed to help some residents at mealtime?
Always. That is, we have a high need for that. We do. It comes in spurts, and at this point we have a lot of residents that need to be fed. And you only have a few of our aides, and sometimes they're trying to feed two at the same time and floating around. It can be very difficult. Our goal is to try to get some feeders in there. They do have to be trained. It's very simple. If you ever had children and fed children, you will know the technique of trying to feed.
Yeah.
And it's just to help the person to be able to eat. But the goal is to try to have them all eat at the same time and not, and to have their meals at the same time and have it be more pleasant. So if anybody's interested in that, we have the clinical nurse that will train them in how to properly do that.
Okay. The residents of Morrisview who are participating in these recreation programs and who have friendly visitors come to see them, what do they get out of it? How does this program and the volunteer program help them?
To give them a quality of life,
Yeah.
and that's what we always say. That's the biggest thing I try to point out, that life doesn't end because you go to a nursing home. And that's our goal, is to still find ways to be able to continue their life. If we have to adapt it with different equipment, different ways, it may not be exactly the same, but to do our best. And sometimes just giving them a hug and just spending 5 minutes talking is one of the most important things to people.
Now, are there opportunities at Morrisview Healthcare Center for scouts, let's say a Boy Scout who's going for his Eagle, or a Girl Scout who might be trying for the Gold Award? Are there any opportunities for scouts to become involved?
Absolutely. I have a lot who call me all the time, especially during the holidays. They like to do the singing and interacting. Right now, I actually, not from the Scouts, but from one of our local schools, we have a small group of students with a teacher that has come in, and they are interviewing residents to write their story of their life. And it's been wonderful for the students at that age because it's history and it's live history. So it's a lot more fun hearing it from somebody than reading it in a book sometimes.
Yeah.
And it's been great. The residents love it because they love to tell their stories, and especially to have some of the younger people in and new faces. So they love it whenever the kids come to visit.
Karen, I'm going to ask you to give us your contact information, the number for Morrisview Healthcare Center, maybe your email address as well if someone is interested in participating in some of these volunteer programs.
Well, they can go on the website, which you had mentioned, which is humanservices.org, O-R-G, and on the website there is a section to get into Morrisview Healthcare and into the volunteer section. So they can read, again, some of the opportunities, and it's got the contact information there. And they can feel free to give me a call. My direct line and is 973-285-2865 or 2864. And my email is Hogan, Hogan, @co.
Morris,
MORRIS.NJ.US.
That's right.
The long thing.
And it's because we normally don't say, we all have the same email address except for our names, obviously, and a lot of times you don't say it out loud, and it gets a little cumbersome at times. But Karen Hogan, I want to thank you very much for being with us today.
Thank you very much.
Now, if you have a question about Morris County government that you would like to have answered, you can call the Morris County Freeholders Office at 973-285-6010. You may also visit the county government's website at morriscountynj.gov. Once you're there, sign up for the county's electronic newsletter, Morris Connections, and also check out the various social networking sites that the county government is involved with. They include Facebook, Twitter, YouTube, Flickr, and Scribd. I'm Joe Garifo. Don't go away. We'll be right back.
Are you pregnant, scared, or a new mother who can't care for your newborn?
There's a safe haven in New Jersey.
You or a friend can bring an infant to any hospital or police station and give up custody safely, legally, and anonymously.
No questions asked. No shame, no blame, no names.
Call 1-877-839-2339 or visit njsafehaven.org to learn more. Remember,
New Jersey has a safe haven for unwanted infants.
Brought to you by the New Jersey Department of Children and Families.
Welcome back to Focus on Morris County. I'm Joe Garifo, Public Information Officer for the Morris County government. On this portion of the program, we are going to learn about e-cycling from my guest. He is Tom Burbridge. Tom is the Hazardous Waste Coordinator with the Morris County Municipal Utilities Authority. Many of us may have recently upgraded our electronic gadgets, our tablets, our cell phones, our laptops, televisions, and so forth. And having done that, the question becomes, what do you do with the equipment that you've just upgraded? Well, here to answer that question for us is Tom. So, Tom, what do we do with this stuff that we've upgraded and that we're no longer using?
Well, we need to recycle these items first of all. New Jersey enacted an Electronics Waste Management Act back in. It took effect January 1st, 2011,
Mm-hmm.
and it requires all residents of New Jersey to recycle their electronic waste. In particular, their computers, computer monitors, televisions, and laptop and any personal computers.
So the Act is very specific in terms of the items that should not be put out in the trash.
Absolutely, very specific. And that is the second part of the Act, that it definitely you're not allowed, residents, people are not allowed to put these items out in the trash.
What is it, Tom, about these items that prevents them from being put out in the trash? What is it about them that is harmful to the environment?
Well, there's lead, mercury, cadmium. These are toxic heavy metals that are in all these items, and they are very hazardous to both human health and the environment. For example, television or computer monitor, there's about 8 pounds of lead in each item. So again, they can be very hazardous to both human health and the environment.
So now I guess the question is, answered part one, we have to recycle these items. And the second part, I guess, of that question is, how do you do that? Where do you do that? I understand in recent years, more towns have been able to accept these items at their recycling facilities. Is that true?
Yeah, that is, Joe. That's been really good in Morris County. We now have 29 of the 39 municipalities in Morris County recycling used consumer electronics at their recycling depots. So that's really good, because it allows residents, they don't have to travel very far. They have the convenience of going right to their recycling depot to recycle their electronics.
And I should mention that toward the end of the program, we're going to be giving you some information, website addresses, phone numbers, email addresses, if you would like to get more information about exactly where you are able to recycle your electronic gadgets. You can go up to the MUA's website, and they have a complete list, for example, of the municipalities that are now accepting these items.
That's correct.
Now, what about non-governmental agencies or retail establishments, Tom? Do any of these in the area accept these items for proper disposal?
Yeah, there are some businesses, Staples, Best Buy, and Goodwill. They'll all accept electronics for recycling. Again, they are listed on our website. They'll give you the addresses of these businesses, phone numbers to call. It might be a good idea for residents to call first, just to find out exactly where they are and where they would bring their their electronics to those stores.
Yeah.
So again, residents can go to our website, www.mcmua.com, where they can find that list of all those businesses.
Now, Tom, during the course of the year, here in Morris County, the MUA sponsors several events. Usually they're conducted in the spring, summer, and fall, where these electronics may be disposed of. In 2013, any idea as to how many of these gadgets you've accepted?
Well, I don't know how many as far as the items themselves, but through the first 3 quarters of 2013, the Morris County MUA collected over 120,000 pounds of used consumer electronics. So that's a pretty good amount. So
Yeah, and obviously all of these electronics that are collected at these MUA events, they're kept out of the solid waste stream, kept out of our landfills, and that is extremely important.
yep, and recycled. Yep.
Yeah. Now, if someone cannot make any of these events that the county sponsors in the spring, summer, or fall, the MUA also operates a permanent facility, a permanent household hazardous waste facility where these items may be dropped off by appointment.
Yes.
What can you tell us about this facility, Tom?
Well, this is the Morris County MUA's permanent household hazardous waste facility. It's located up in Mount Olive. As you said, it is by appointment. We're open most Tuesday, Friday, or Saturday morning. And residents would call our MUA hazardous waste hotline, which is 973-829-8006 to make an appointment for that facility.
Is this open only to Morris County residents? What about businesses or schools or those kinds of establishments?
It is open to well, residents obviously, but it is open to schools, businesses, out-of-county residents also.
Now, when a resident goes to dispose of these e-waste products, is there a charge?
No charge for Morris County residents, but your larger businesses, out-of-county residents, there are fees for those items.
Now, besides e-waste, Tom, I understand this facility accepts a number of other products which are deemed household hazardous waste. Can you give us some examples?
Yeah, I mean, just about any hazardous waste from your home, household hazardous waste, automotive fluids such as motor oil, antifreeze, gasoline, brake fluid, power steering fluid, transmission fluid, car batteries, rechargeable batteries, button cell batteries, pesticides, herbicides, fertilizers, oil-based paint stains, paint thinners, driveway sealant, what else? Propane tanks, helium tanks, fluorescent light bulbs, pool chemicals, darkroom chemicals, any mercury-containing devices such as thermometers, thermostats, and asbestos. So pretty much anything that comes out of the house that's hazardous we take, yes.
Is there a proper way of handling these kinds of materials? For example, if I had some kind of household hazardous waste in my home that I wanted to bring to the facility, what is important for me to know in terms of how to handle these chemicals?
You want to make sure they're packaged properly. You want to make sure the lids are on tight. Maybe in some cases overpack something. Maybe you have a bottle of something, you have a cap on it. Maybe put it in a tub, you know, if it's a liquid or something. Sometimes people bring fertilizers and things like that. Maybe put bags break open in their vehicles. You want to make sure you bring it up so you don't have a mess in your vehicle. You don't want anything interacting. So you want to make sure the containers are in good shape and sometimes overpack them. Bags in plastic bags, whatnot. Yeah, that's the best, you know, and especially if something like mercury, we tell people jar, put it in a bag, overpack it in a bucket, lid, because if liquid mercury leaks in your car, you got a real problem.
Even something as small as a thermometer, a fever thermometer?
Yeah, thermometer, absolutely. Overpack it. Put it in a Ziploc bag, then put it in a plastic bucket. Absolutely, yeah.
Now, if someone got their flat screen TV upgraded, or someone maybe got their laptop upgraded, or their desktop computer upgraded, these things have screens that, if they're not handled properly, I assume the screen could crack, could break. Is that a chemical problem? Should that happen? I mean, would you advise that they properly wrap the screens?
I think with the TVs and stuff and the screens, people are bringing us ones that are busted out of the plastic casings. Leave them intact.
Oh, okay.
The thing is, that's the danger. If people take the picture tubes and stuff and they take them out of the case, and for whatever reason, you know, and because if you knock the back off of these things, they can blow. So people need to leave them whole. and we can take them. The safest thing to do is bring them whole, rather than
Okay.
taking them apart and giving them to us in pieces.
Okay. Tom, I'm going to ask you to give us the information again about the household hazardous waste facility, and especially the phone number, because again, you may bring these items there, but you should call ahead of time to make an appointment. So Tom, why don't you give us
Absolutely.
that information again?
Okay, so it is our Morris County's household hazardous waste facility. It's located up in Mount Olive by appointment. Like I said, most Tuesday, Friday, or Saturday mornings. To call for an appointment, residents can call the 973-829-8006 number. And you can call the day before. I mean, we'll tell residents what days are open when we're up there, and we can set them up nice and easy. The good thing about it, there's no lines. You come up and we can get you right through there.
Although, I know when the MUA does sponsor the household hazardous waste disposal events,
Yes.
Either at the Public Safety Training Academy, or I know you go from town to town, the operation is very efficient, and initially there may be some lines, but normally it moves pretty quickly.
Yeah, we worked out quite a few of the bugs out of those events, and we've got them running pretty smoothly, so people don't usually have to wait too long to get through there either. So.
Now, I also want to give you some general information, contact information about the Morris County MUA. Should you have a question about recycling or about anything else that the MUA does, 973-285-8390 would be the office number to call. You can also visit the MUA's website, which Tom mentioned earlier. That is mcmua.com. And you can also, if you're a Twitter follower, you can follow the MUA on Twitter. It's twitter.com/mcmua. Well, Tom Burbridge, I want to thank you very much for being with us today and explaining about e-cycling, which is very important, again, as we say, especially if you've upgraded any of your electronic gadgets. Now, if you have a question about Morris County government that you would like to have answered, you can call the Morris County Freeholders Office, and that telephone number is 973-285-6010. You can also visit the county government on the web. That's morriscountynj.gov. And once you're there, why don't you take advantage of the many social media that Morris County embraces. You can like us on Facebook, follow us on Twitter. You can check out some past informational videos on our YouTube channel, browse through the county's document library on Scribd, and check out some of our photos from various county events on Flickr. I'm Joe Garifo. Thank you very much for being with us. Tune in again next week at this time, won't you, for another edition of Focus on Morris County.